Hello friends. Today I am going to tell about herniated disc or slip disc or prolapse of inter-vertebral disc. What is herniated disc? What are the symptoms of herniated disc? And what is the role of homeopathy medicines to relieve the symptoms of herniated disc?
Subscribe now and press the bell icon. Never miss an update.
So before going in details, I would like to tell something about spine. What is spine? What is spinal cord? And how it is formed, about its anatomy, so that it will be easy to understand what is herniated disc. So what is spine? Spine, which is called the backbone of our body. That spine starts from the base of brain and continues downwards up to the last portion of the back portions. Those spine consist of tiny bones. Those small bones are called vertebrae. Those vertebrae are arranged in such way that it placed one after each other and it makes a tube-like structure. In the hollow portion of the spine, the spinal cord runs downwards. The spinal cord is the continuation of the brain. It is a tubular nerve fibers that passes in the spine from the base of brain, the end part of the spine. So the role of the spine is to protect the spinal cord from an external injury, and also the role of spine is to bear the weight of our body when we are working, when we are running, or when we are jumping, any sort of work, what we are doing, it bears the load of our body. Okay, the main role of the spine is to bear the load of our body and to protect the spinal cord. The spine, which is made by the vertebra, in between the two vertebrae there is a round-like structure which is called disc. As it is placed in between the two vertebrae, so it is called inter-vertebral disc. That disc is at the central portion of the disc is soft and it contains some soft jelly-like substances. Okay, so in between each vertebra, the disc are present. So the disc bears the weight of our body. The spinal cord, which comes out from the base of the brain, from the spinal cord there are number of spinal nerves comes out. The spinal nerves supply the nerves to different parts of our body. From the neck portion or the cervical portion, the spinal nerve which comes out from our neck portion, it is called cervical spinal nerves. The spinal nerve comes from our back portion of the chest, it's called thoracic spinal nerves. The spinal nerves comes out from the back portion, it's called lumbar spinal nerves. So the cervical spinal nerves, it supplies the nerve to the shoulder portion, to the chest portion, to the hand portion. The thoracic spinal nerves supplies the nerve to the chest portion, to the abdominal portion. The lumbar, the back portion, the lumbar spinal nerve supplies the nerve to the hip portion, to the pelvic portion, to the leg. Okay, so there are 31 pairs of spinal nerves. Those spinal nerves comes out from the spinal cord just at the side of the disc. So for any reason, if the disc is getting ruptured and the jelly-like soft substance if comes out or it bulges out, if it press to any spinal nerve, so we will feel pain on that area which is supplied by that spinal nerve. So herniated disc or slip disc means the bulging part of the disc when it presses to any spinal nerve, and when we feel pain by the compression of that spinal nerve, That is called herniated disc or slip disc. Slip disc does not mean that the disc has been slipped from its place, but it is the compression of the spinal nerve by the bulging of that content of the disc. So this is the common cause of herniated disc. Now I am going to tell about homeopathy medicines, how it helps in herniated disc problem, and what are the homeopathy medicines that are generally prescribed in herniated disc problem. Homeopathy medicines helps to relieve the pain. Homeopathy medicines also helps to prevent further damage of the disc, and thus homeopathy medicines can be used very safely in herniated disc or prolapsed disc problem. The first medicine is Rostux. The symptoms of Rostux is the pain is worse on sitting position and it's better by motion. Suppose a person is having back pain, having backache, it is worse in sitting position. The stiffness of the back portion is more on sitting position. When he is getting up from sitting position, the pain is more. But when he is walking, when he is moving, the pain is relieved. But the pain is better. Then Rostux is the suitable medicine for that case. Second condition, in the morning time, when the patient is waking up and starting to move, the pain is worse. On first move, when the pain is worse, Rostux is the good medicine. Rostux is the best medicines. When the person first move from a sitting conditions and he feels more pain in the first starting part of the initial part of the walking, and after a while when it's getting relief, then you can prescribe Rostux in that case. The second medicine is Brownia alb. The Brownia alb is generally given when the pain is relieved by rest and worse by any sort of motion. Suppose the person is in rest condition, he is sitting quietly, he is lying quietly, there is no pain. But when he is moving, when he is moving or walking or moving his body also or twisting his body also, he is getting pain, then Brownia is the suitable medicine for that patient. Because when the pain is relieved on rest and worse by movement, Brownia is the first medicines. Besides that, the pain is in Brownia is like pricking like pain. Suppose you have the pain in the back person, you have stiffness in the back person, it is pricking nature of pain, and in the cervical person, in the neck person, you have pain and it's pricking in nature. So in pricking nature of pain, and the pain is worse on movement, but it is better on rest condition, Brownia is the suitable medicines. Next medicine is Gnapalium. Gnapalium is generally given when the pain is associated with numbness of the part. If there is a backache, if there is stiffness of the back person, if there is pain in the leg person, and the pain is associated with the numbness of that part, then Gnapalium is the best medicines. The pain, wherever the pain is present in back person or in the neck person, if the pain is associated with the numbness of the part, then Gnapalium is the good medicine to prescribe for that patient. Other two medicines is Colocynth and Macphus. Colocynth and Macphus are generally given when the pain is neuralgia type pain. That means the pain starts from a part and it radiates downward. Suppose the pain is starting from the neck person, it is radiating to the arm, and there is agonizing pain, the radiation of the pain, the neuralgic pain, and the pain also in the lumbar portion, in the back portion also pain is it's radiating from the hip portion to the leg portion in case of sciatica, and the pain is severe pain, it's agonizing pain, it's radiating pain, and the pain is relieved by pressure. After applying pressure, after giving pressure, if the person is feeling better, and if you are applying warm application by giving warm fermentation or by giving warm application, the pain is getting relieved, then Colocynth is good medicines for that case. But Colocynth generally is a left-sided remedy. So when the pain is in the left portion of the body, in left side of the leg or left side of the hand, in case of cervical spondylosis, there is a left side pain in the left hand, or in the lumbar spondylosis or herniated disc will be in the left side of the part, the back pain is the back pain that origin from the left side of the hip portion and it radiates to the downward to the leg and it relieved by the hot application and relieved by the pressure, then colocin is the best medicine to give. In contrast to colocin, MACPUS has the same symptom like it radiating pain relieved by warm application, relieved by pressure, but it is a right sided debate. So colocin and MACPUS are given in neuralgic pain. The pain radiates from one part to another and is a radiating like pain, and the pain is relieved by warm application and applying of pressure application. The pain is relieved, but the colocin is given in the left-sided condition and the MACPUS is given in right-sided conditions. These are the common homeopathy medicines generally prescribed in herniated disc problem or slip disc problem. There are so many other medicines also that helps in herniated disc problem. As in homeopathy, you don't have any specific medicine for any specific disease, so we generally selected the medicines as per the symptom basis of the patients. So you should consult us for further treatment, for detailed treatment, and as per your symptoms, if you are taking the medicines, it will give a long-term relief to your health issues. So friends, if you feel it is informative, please subscribe my video, and if you have any health queries, please contact us, the number given in the screen. Thank you very much.